Hi everyone, I'm choosing to do my oral presentation over my children's cat. So I have patient JM. He is here in clinic today for his newborn 5-day checkup at Loving Care Pediatrics in Jersey Village, Texas. Patient's here for 5-day follow-up. Patient was born on 10/21/15. Today, mom reports that baby has been spitting up after each formula feed, but is able to keep down breast milk, has no other complaints or concerns at this time today. So far as all the baby's tests that were done in the hospital, his hearing screen, his heart exam, all of that, he passed. There are 3 adults living in his home. No questions or concerns, changes, stressors by the parents. Child's primary caregiver is the mother. Baby is breastfeeding 10 to 20 minutes on each side every 2 to 3 hours, and mom is supplementing with Similac Advanced 2 to 3 ounces every 2 to 3 hours, so a total of about 6 to 10 feeds per day. Baby is having anywhere from 6 to 8 wet diapers and is also having 2 stools every day. Past medical history: born at 36 weeks, preterm via C-section. APGARs were 9 and 9. Mother was a chronic marijuana user during pregnancy, so the infant's urine drug screen was positive for marijuana at birth. His weight was 6 pounds. Baby's blood group is O positive, Coombs negative, and CPS cleared them for discharge. So family history: mother and father alive, no significant past medical history on either paternal or maternal side. Social history: baby lives with mother and maternal grandmother. Baby's father does not live in the home but is active in the care of the baby. Mother's an outside smoker only and denies any weapons in the home. There are 5 dogs and 1 bird in the home as well. Child Protective Services were contacted when the mom and baby were still in the hospital due to the positive urine drug screen. Mother admitted to smoking throughout the pregnancy but denies any use today. No other illegal drugs or alcohol. Social Services made 1 visit to the home. When the baby was released from the hospital, they took pictures, did a walkthrough of the house, and gave clearance per the parents. Currently, the baby's not taking any medications. Review of system was unremarkable other than mom and dad reporting that baby is spitting up after each formula feed, but they deny any cough, runny nose, diarrhea, vomiting, anything like that. Vital signs: baby's birth weight is down to 5'12" from 6 pounds when he was born. And his general appearance, he is basically jaundiced from head to toe. So baby was very jaundiced, alert, active, didn't appear to be fussy. The rest of his physical exam was unremarkable from his head all the way to his neuro exam. Normocephalic with interior fontanelles open, atraumatic. Skin was normal other than the jaundice. Red reflexes were bilaterally there. There was no thrush in his oral cavity. Heart was normal. S1, S2, no murmurs. Lungs had good air movement. No wheezes, rales, or rhonchi. Abdomen was soft, not tender. The placental cord was still intact. His extremities were fine. He is a circumcised male with testes down bilaterally, and the circumcision was healing nicely. So for assessment, baby was jaundiced. So we sent the mom over to the Cypher Hospital to have bilirubin levels drawn, and also for further assessment from the hospital. So once the mom and dad went over to the hospital called us back with the lab results, and the total bilirubin was 15.1. As well as sending over for labs, we switched the baby's formula to Similac Sensitive to help with the spitting up, and encouraged mom to burp after every ounce of feeding. As well as preventative medicine topics were addressed for fever, respiratory distress, bottle propping, nutrition counseling, and all of that. So since this baby had jaundice, I was just thinking, is there anything else other than photo light therapy that we can use for jaundice? Because babies have several things that are kind of working against them that cause their jaundice, such as increased bilirubin production because their red blood cells are breaking down faster, decreased bilirubin clearance, and then increased enterohepatic circulation. And that's what the direction I kind of went in. So baby's gut is sterile when they're born, so they don't have any bacteria that can help break down the bilirubin to urobilin, which is secreted in the feces. And so my clinical question was the addition regarding neonates with jaundice, does the use of probiotics in addition with light phototherapy decreased the levels of serum bilirubin earlier versus just using light phototherapy alone. And what my results showed was that the addition of probiotics to light phototherapy in neonatal jaundice lowers the bilirubin levels faster than just using photolight therapy alone. My main article that I used was a clinical trial. It's called Therapeutic Effects of Probiotics on Neonatal Jaundice. There hasn't been a lot of research done over this, but this article that I found did show that using probiotics in addition with photolight therapy significantly decreased levels of bilirubin faster than just using the photolight therapy. So they tested babies. They had a control group and a treatment group. The control group was just getting the photolight therapy. The treatment group was getting probiotics as well as photolight therapy, and they tested on days 1, 4, and 7, and the group with the probiotics, their serum bilirubin levels decreased much more quickly than just the group of the photolight therapy. So for future reference, I would like to see babies with jaundice have the addition of the probiotics to get their levels down quicker, because we know that high levels of bilirubin can be dangerous in babies. Thank you.